Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Our topic today in Neighborhood Health Watch is urinary incontinence and pelvic organ prolapse. The common term, urinary incontinence, and treatment for it depends on the type of incontinence, its severity, and the cause. Sometimes a combination of treatments might be needed. Also, if an underlying condition is causing urine leakage, such as multiple sclerosis, Parkinson's disease, a stroke, or even a spinal injury, your doctor will treat that condition first. Dr. Meghana Gowda with Retreat Hospital is here to get us informed on the topic. Welcome and thank you for joining us for First and Four. What are some of the symptoms, and is this a normal part of getting older?
So incontinence is really just the formal way of saying leakage. So leakage can happen with laughing, coughing, sneezing. It can happen unprovoked. It can also be sometimes a result of something called overactive bladder, where you have the urgency and you're really rushing to get to the bathroom. A couple things to know. It is a medical condition. This is not a cosmetic procedure or something like that. It's a medical condition. It's not a common part or consequence of aging, but it is common overall. We tend to see it a whole lot.
All right, and what are some of the causes and even the risk factors involved?
So genetics plays a huge role in this. Genetics, active lifestyle, which is good. We want you to be active for your heart health, your bone health, neurologic conditions, having children, all of those things.
Is this exclusively a female problem? We hear some of the causes happening because of pregnancy and that type thing, obesity even.
Sure.
Is it a female thing exclusively?
You know what? I think it is more commonly a female issue, and it's something that we as a specialty, it's a separate specialty to treat women. It's a combination of urology and gynecology, which is why we hear about it more commonly in women.
Okay, and when should a person see a doctor, and how do you prepare for that visit?
Really, if it starts to bother you, you should see a doctor. I mean, the last thing we want is for you to start limiting your activities, limiting your social activities or exercise because of something like this. So if it bothers you, come in and we'll just have a conversation. It doesn't commit you to surgery. I mean, most of these things can be treated without surgery, actually.
That's what my next question was going to be, talking about some of the treatment options. What are some of the surgical options and non-surgical options here?
So starting with non-surgical options, that's always our first choice because we don't want to commit someone to surgery unless they really need it.
Right.
So physical therapy, medication, lifestyle changes, and you know what, if you do need surgery, most of these options are very minimally invasive outpatient procedures that take less than an hour.
And what's the takeaway that you would like our audience to have?
Just to come in, write down your questions. We'd be happy to evaluate you. We'd be happy to go over the options with you. Just come in and ask your questions. It doesn't obligate you to do anything.
Don't get all anxious about it.
Exactly.
Right. Dr. Gowda, thank you so much for joining us.
Thanks
We appreciate
so much for having
it.
me.
Tracy